Did you know that simple science-backed practices in childcare can significantly reduce illness, improve nutrition, and boost children's health? Let's break down what the research really shows. Children's health in childcare is not just about avoiding sickness, it's about creating a healthy environment where they can grow, learn, and thrive. So what does the evidence say? First, let's talk about getting sick. Research shows that structured infection control programs for childcare workers, like hand hygiene training, directly improve their hygiene knowledge and practices. This simple step helps reduce the spread of all those common illnesses that seem to pop up constantly. Now, what about food? Children in daycare often eat many of their meals there, so nutrition is key. Studies find that when childcare providers stick to nutrition best practices, it leads to better diet quality for the kids. Efforts to implement recommended standards, like the Child and Adult Care Food Program in the U.S., have been proven to improve the quality of meals and snacks served in centers. It's not just about filling bellies, but about fueling growing bodies and brains. Health education also makes a huge difference. A major review of nurse-led education programs in childcare settings found they can actually reduce respiratory illnesses. These programs also improve caregivers' health practices, including their first aid knowledge, which is incredibly important. But the evidence doesn't just focus on illness. Overall health and development are tied to the quality of childcare. A global review found that childcare attendance can support better growth and developmental outcomes, but only when centers provide hygienic care, good nutrition, and supportive learning environments. Quality is everything. So, what can we do with this information? Here are some practical evidence-based tips for both caregivers and parents. First, promote hand hygiene and cleaning routines. Teach and model regular hand washing for both children and staff. Make it a fun and consistent part of the day. Second, follow nutrition best practices. Plan balanced meals with plenty of fruits, vegetables, whole grains, and lean proteins. Try to eat the rainbow and involve kids in learning about healthy foods. Third, use evidence-based education programs. Look for opportunities for staff training in health, illness prevention, first aid, and nutrition. An informed team is a prepared team. And finally, monitor health policies. Stay updated with your local health guidelines and evidence-based childcare health standards. These are in place to protect everyone. Creating a healthy childcare environment isn't accidental, it's intentional. By using these science-backed practices, we can protect children from infection, support their nutritional needs, and foster environments where they feel safe, well cared for, and ready to thrive. Now it's your turn to start applying these tips if you're caring for children at home. Thanks for watching. If you found this helpful, be sure to like this video and subscribe for more evidence-based tips.